Good evening, Houston, and for those that are across the United States of America, we welcome you to part two of the Health Equity Response Task Force, Mental Health in Minority Communities during the during the COVID panic, that is, part two. We want to say thank you on behalf of Mayor Sylvester Turner. My name is Janice Weaver, Director of Community Relations, and I will begin our presentation for the evening. We have a couple of housekeeping tips here we would like to share with you. We want to tell you that we have languages and accessibility. This town hall is available in both American Sign Language and Spanish via language interpretation. For ASL, please follow along with our interpreters on the video in the main panel. To listen in Spanish, please follow these instructions. On the lower right-hand side of your screen, there should be an icon like this one that says interpretation. Click on it. A menu should pop up. From this menu, select Spanish. You should now be listening to the simultaneously interpretation of the meeting in Spanish. Thank you. I also would like to acknowledge the 15 members of the Mayor's Faith and Community Leaders Subcommittee, chaired by Dr. Irishea Hilliard, and this particular session is also co-chaired by, and Dr. Hilliard is she's the senior pastor of New Light Church, and then Pastor Michael Pender of Fallbrook Church. Next slide, please. And then I would also like to thank my colleagues. There are 6 members that lead this task force. We began in April of 2020. We were all appointed by Mayor Sylvester Turner, and they are all division directors with implementation, visioning, and support from the H.E.R task force and its subcommittees. We have over 50 civic leaders, including medical specialists, public health professionals, communication creative, data scientists, technical experts, and faith community leaders who were appointed by the mayor to design and implement equitable COVID-19 relief and recovery. Next slide, please. And we are showing all of these panelists for this evening. We want to thank each and every one of them for being here. Our moderator for the evening will be Dr. Marcus Cosby. He's the senior pastor of Willow Avenue Baptist Church. Thank you so much. And our next slide is, I'd like to, at this time, to introduce you to Dr. Irishea Hilliard. She is the senior pastor of the New Light Church, and she chairs the H.E.R task force. And she is also our chair for the Faith and Community Leaders Subcommittee. Dr. Hilliard.
Thank you, Director Janice Weaver. I greet you all today, and I trust everyone is having a wonderful evening. As stated, I serve as co-chair of the H.E.R Task Force Faith-Based and Community Leaders Subcommittee, and that's made up of a phenomenal group of leaders. I also want to give another shout out to Dr. Michael Pender. Our objective in this season of the COVID pandemic was to work together as a group to see how we could impact and help our community move forward during these challenging times. And so we've done various things to do that, but one of the main assignments was to show how mental health and faith-based communities can work together. You can go to the next slide. These slides will just show you some information about how COVID-19 has had an adverse impact on the mental health of those in our community. It has impacted communities in various ways, whether it's dealing with death, whether it's dealing with situations. And even in June, the U.S. adults reported elevated adverse mental health conditions associated with COVID-19. Next slide, please. As you can see by this slide, just the different percentages that have been available and also the resources for stress and coping strategies. And so our whole desire today, you can go to the next slide, is to give you information on how you can improve your mental health as well as your children. It is stated that 1 in 5 children experience a mental disorder in a given year. So this conversation is not just for adults, it is also needed for the youth in our community, because 27% of these youth experience disorders so severe that their ability to function is significantly impacted. Next slide. And so I want to go over the agenda for today. We have a group of amazing individuals that make up our community to speak to you from the faith-based perspective, as well as the community and mental health perspective. The Bible says, "Beloved, I wish above all things that thou mayest prosper and be in health." And so while many think that you have to separate faith and mental health, the two work together so that you can live a whole life. We'll have a mayoral address from our mayor. There'll be a panel on the unraveling of social networks, social isolation, grieving, processing death in the pandemic, exploring mental health interventions for our youth and adults. Director Janice Weaver will come back and give us our next steps, and then we'll have closing remarks from our mayor, so make sure that you stay to the end. The great thing about this part 2 session is that we all get to experience every panel instead of you going to breakout rooms. My next responsibility is to introduce our Master of Ceremony on today. He's no stranger to the Houston area. He is the Reverend Dr. Marcus D. Cosby. He is the senior pastor of Wheeler Avenue Church right here in Houston, Texas. And although he's a proud native of Chicago, Illinois, he's been in Houston long enough that we claim him as our own. He's married to his high school sweetheart, and they have been blessed with 3 beautiful daughters and 2 amazing sons. As the successor to the founding pastor of Wheeler Avenue, Dr. William A. Lawson, Pastor Cosby has been blessed to continue the ministry of this intentionally intergenerational congregation in the inner city of Houston, Texas since 2004, having served as associate pastor since 1998. Under his leadership, he has started the Wheeler Avenue Christian Academy, opened a transitional housing facility for homeless and single mothers right there in the Third Ward community of Houston, and also had various mission projects. And so Dr. Crosby seeks to encourage and empower all humanity through the timeless and transformative truths found in the Word of God. I present to you our Master of Ceremony tonight, the Reverend Dr. Marcus D. Cosby.
Thank you so much, Dr. Hilliard. What a blessing it is to be in relationship and fellowship with you tonight and with all of you in the Houston community. Thank you so much for the privilege of sharing in this most necessary conversation. And as we hear from our panelists and all these who have been trained to give us leadership in these various areas, we are expecting a wonderful time as we continue to think about our mental health and our wholeness, even during this COVID-19 pandemic. It is my treasured honor to present the 62nd mayor of Houston, Texas. He has been serving this great community since 2016. He is my beloved brother and friend, in addition to being the mayor of this great city. Will you please help me to celebrate our Honorable Sylvester Turner?
Thank you, Dr. Cosby. And look, it is an honor to be on this program with you this evening, and with everyone else, and to Pastor Irishea Hilliard, and I want to thank her for the time and the effort that she has given to us on this effort. And of course, I want to acknowledge Janice Weaver for her stewardship and leadership and everything that she's done on behalf of the city of Houston and people who live in the city. So look, let me thank all of you for participating on what I consider just to be an important discussion. I had the privilege of being and listening to the last one, and I just thought it was so, the information that was provided was so helpful. I encouraged Janice Weaver and the Health Equity Response Task Force to come and do it again, because it's quite timely. And so we're 5 months now into the global public health crisis. We continue to battle this virus, to slow down the community spread, and to adjust to living in a pandemic. And I will tell you, I don't care who you are, it has not been easy. Early today at the news conference that I had, I announced 487 new positive cases in the city, and we added 17 more people to the list who have died from this insidious virus. That brings the total to 59,871 positive cases inside the city of Houston. And the total number of people who have died up to today, including today, is 696. The virus has taken a heavy toll on communities of color. And even if you are not diagnosed with the virus, 5 months of living through a pandemic, it really starts to weigh on you, heavy on your hearts and your minds. It begins to take an emotional and physical toll. And we need to talk more about how we can get through this together. I say it often in my news conferences, but I can't repeat it enough. Social distancing, masked up, washing your hands, using sanitizer, getting tested. These are all the steps you can take to slow the spread of the coronavirus. But it's that very first step, social distancing, staying at home, telecommuting, avoiding being around people. That first step has led many of us into social isolation that has its own challenges. And as lonely as this time can feel, please know that you are not alone right now. We are all standing with one another. And I want to thank each of you for prioritizing your physical and mental health by participating in this town hall, navigating through this unprecedented combination of health, economic, political, and social challenges. As many of us kind of feeling sad, at times helpless, anxious, and even at moments a little bit angry. And no matter where you live or your age, people simply need help right now. And no one should be ashamed of reaching out and asking for help. And whether you're dealing with the death of a loved one, personally recovering from coronavirus, struggling financially, coping with sadness or depression, I'm here to tell you that you're just not alone. And as your mayor, I want to do everything I can to make sure we can all get through this crisis together and begin the healing process. And it's more important than ever that we prioritize self-care and reflect on our own emotional well-being, that we keep our faith intact and that we keep moving forward. And when all of that seems impossible, it is okay to say that I need help, and it's okay to get help from mental health professionals. And tonight, that's what we wanted to do. We want to bring some people before you that can really provide you with some good, sound, solid information. The CDC released a report on August 14th that said the symptoms of anxiety disorder and depressive disorder considerably increased in the United States during April through June of this year. That's more than feeling the blues. Those are signs of a need for mental health intervention. And tonight, our goal is to educate and empower you with the tools, the knowledge, and resources available to help all of us get back to our best selves. And this dark and difficult time in our nation certainly will not last forever. Things will get better. And so together, we're in this. And it will take all of us working together for our city to get better. And that's why I proclaim August of 2020 as Better Together Month. So let me thank all of you for joining tonight. And I look forward to hearing all the panelists and getting the information. And trust me, even though I may be the mayor, prior to the coronavirus, I was used to going every single day, finishing up at City Hall during the day, going to some banquet, some town hall, some meeting at night. And my mind and my body got used to it. And then when this coronavirus came down, the banquets went away, the town hall meetings in terms of being in person, those went away. And then I found myself at about 6:30 or so leaving City Hall, and the mayor's detail said, "Mayor, where are we going?" I said, we're going home. There's nothing for us to do this evening. And then you find yourself, I found myself at home and looking around and just said, this is a whole new world. And, I just had to stop. And there was a moment or two when you just have to I had to get my own stuff together. So this isolation can be hard for anybody, but I'm so thankful that we have a number of people who have given up their time and their talent tonight to help us all move forward in a very positive way. So thank you, Dr. Cosby. I look forward to listening to everyone.
Thank you, Mr. Mayor. And let me thank you so much for your stellar leadership during this time. You've certainly led us through quite a bit since 2016. We've had to deal with storms and other challenges, but your leadership during COVID-19, during this pandemic, has been noteworthy, has been stellar. We do thank you very much for being the kind of mayor who has received national prominence because of your leadership on this effort. So we thank you so much for that. And may God continue to bless you and use you. All right. Well, brothers and sisters, I'm grateful that you are with us tonight. We're going to have a wonderful time of conversation with these medical experts and community leaders and faith leaders who will help us, guide us through this conversation of maintaining our mental health. Yes, it is true that we are better together. As a matter of fact, we are called to live in community with one another. And so our first panel tonight will help us to understand some things about the necessity of maintaining some kind of communal aspect as the unraveling of social networks continues to happen in our world. We know that we've been called to be socially distanced. That is most healthy for us right now. But it is difficult for us to be apart from one another because we're better together. We're called to be in community. But will you now receive these brothers and sisters who are going to help us to walk through some conversation regarding the unraveling of our social networks and dealing with social isolation. I present to you first the moderator of this panel, Mr. Derek Muhammad. He will come and share with us. He, of course, is a wonderful organizer in our town, and we're grateful for his activism and all the work that he does here in Houston, Texas. And in addition to him, he will moderate a panel with leading voices who are persons who continue to commit themselves to ensuring the progress of our community. Reverend Rodrigo Vargas is here. He's the lead pastor of Union Houston, and we're grateful for him. Dr. Angela Jones is here from Get Centered Counseling and Consultants. And Dr. Kathy C. Flanagan is here. She's board certified psychiatrist. I'm going to ask Mr. Muhammad to lead us as he is led, and as he shares with us today, and as they share with us, we'll understand a little bit more about how we can be better together despite our quarantine season. Mr. Muhammad.
Thank you, Dr. Cosby. And let me greet everyone on this fine evening. My name is Derek Muhammad. It's an honor and a privilege and a pleasure to be moderating the first panel. I'd like to start by saying that this town hall meeting is not just important, but it's critical. And it's critical because during this global pandemic, it's very easy for us to quantify the economic loss. It's easy for us to quantify how this is impacting us politically and economically, but it's not so easy to quantify how this is impacting us mentally and emotionally. And we must be of the mindset that talking about mental health and discussing our mental health issues does not make us a weaker community. It makes us a stronger community. And so, as Dr. Cosby has already introduced our all-star panel, I would just like to give each one of them an opportunity, starting with Dr. Kathy Flanagan, to introduce themselves. So we'll go with Dr. Flanagan, Dr. Jones, ladies first, and we'll end with Reverend Rodrigo Vargas.
I'm Dr. Kathy Flanagan, a board-certified psychiatrist. I've been in solo private practice for about 30 years, a little bit over 30 years. My area of expertise is in treating patients who suffer with depression, anxiety disorder, and bipolar affective disorder.
Dr. Jones.
Hello, I am Dr. Angela Jones. I'm a licensed counselor. I have a practice called Get Centered Counseling and Consultants. I am the lead therapist there, and I specialize in adolescents to adults with those with anxiety, depression, relationships, and I specialize in sex.
Okay. Reverend Rodrigo.
My name is Rodrigo Vargas. I'm honored to lead a vibrant and diverse church in the inner city of Houston. We mainly deal with people that are living in sober living homes or have come out of the human trafficking. We deal a lot with outreach in the homeless community. There's a lot of poverty around our church and where we gather. So it's an honor to be here to help you make a difference.
All right. Thank you, Reverend Vargas. Now let's dive right into question number one. We heard Mayor Turner speak of how the COVID-19 pandemic has even impacted him socially. We're used to being able to go to church and socialize. Our children are used to being able to go to school and to the various universities to socialize. We're social creatures by nature, but, and we'll start with you, Dr. Flanagan, that has been pretty much stripped from us in a major way. Question, how can we encourage youth to make appropriate public health decisions even when their peers are not supportive?
Well, let me first say that teens are not made to isolate. They're at that age where they want to be socially connected. That's a part of their being. We know it was back on March 12th, 2020, that the World Health Organization announced that we had a global pandemic. That changed all of our lives. So even although youth have an extreme difficulty socially isolating, so do adults.
Right.
We find ourselves getting lonely because you're not out talking to friends, going to church, or being socially connected with people that you love. One of the things that we can do to encourage youth to really follow all of the guidelines, public health guidelines, is to really communicate with them. Make it very personal so that it makes sense to them. We can't be very logical when we talk to adolescents or youth because they're not going to connect with that. Also, you want to talk about the need for them to be socially responsible, because when they have children or grandchildren, you're going to want to be able to tell the story how you got through the pandemic. So many people might not be here, just as the mayor mentioned, that we keep losing people every day. So you need to talk to the youth and encourage them. Although their friends might not want to, they need to, because they love their parents, they love their grandparents, they love their friends, they love their teachers. So they have to follow the guidelines of socially distancing, masking up, as well as washing their hands.
Dr. Jones, how do we deal with what they call the YOLO generation? YOLO, which is an acronym for you only live once.
Right.
You only live once, meaning I don't have to wear a mask. I don't have to socially distance. I only live once. I'm going to live my life, and I don't care what anyone says. How do we encourage them to follow the guidelines?
Part of what Dr. Flanagan was saying was the communication piece, but there's also like, how are you going to communicate with them so you can understand that you have been through this stage as well? So the YOLO stage, as you're saying, you want to make sure you understand and you show them, like, you validate their disappointments, you talk to them about what it is that you're missing as well. You know, they're missing big moments in their life right now, graduation, prom, homecoming. They're missing all these big pivotal things in their lives, and it's being taken from them. And you want to encourage them to feel like, okay, I can talk about my disappointments with my parents, and maybe we can come up with a solution so they don't feel so lonely. Right now, you know, we can sit there and tell them, you know, you have to wear a mask, you have to do this, you have to do that, you have to social isolate from your friends. But if you're not showing them that you're having some of the same disappointments, you're having some of the same frustrations as them, they will be less likely to listen to you. Teens want to feel like they could connect with their parents. You know, parents to them is like somebody that they don't understand anything. They just don't get life. So if you can show some of that empathy towards them, they'll be more likely able to listen to you when it comes down to those moments of like YOLO. They'll actually remember what you said. So communicate, but also it's about how you communicate. You have to connect with them, get on their level sometimes.
Yeah, I agree. We got to be relatable.
Yeah.
Reverend Vargas, how do we inspire them to not cave to the peer pressure, if you will?
I think this goes down to leading by example, I think first and foremost. And then the second thing I would say is, you know, it's not just about finding common ground. I think it's very important that once you find common ground, you connect with them on an empathetic level. And once you've connected on an empathetic level, I believe you can begin the encouragement. I've noticed this during my tenure as a youth pastor is if you encourage a teen that hasn't, or a young person that hasn't yet opened up, they can get very defensive. So it's extremely important that once you find that common ground, whether it's music, a TV show, something they're wearing, is find a place where you ask questions and give them the empathy they're looking for. And it's at that moment that you can begin to encourage and inspire them. It's only a legacy you're leaving behind.
Okay, thank you. Thank you, Reverend Vargas. You fell off there for a second, but maybe it was just me. And I agree, we do have to meet our young people on common ground. And that being said, I want to give a shout out to the mayor and the city of Houston for their Mask Up campaign, because what they've done is they've taken figures that our young people are influenced by, who are encouraging them to mask up through this campaign. And I think that's working very well. Question number 2, we're gonna dive right in. We're gonna go back to you, Dr. Flanagan. How do we protect our children, especially those who are quarantined with an abusive parent? How do we protect them, especially those who may be quarantined with an abusive parent?
You know, that's such a difficult question to answer because, you know, given that we're all quarantined, a lot of the helplines are not as active as they once were. Also, children are not going to school, so we can't put our eyes on those children who perhaps we maybe suspected that they were being abused. There are a lot of things that have changed since we all are being quarantined right now. One of the things we want to be sure and do is make sure that that there are helplines, that the children have access to the social media, and that they know which numbers to call. There is a child helpline that children can call as well as youth if they're having any difficulty. But if we all also need to be aware that it's not only children or youth being at high risk for being abused during this time. You're going to also find women, older people, those people suffering with mental disorders or have a disability. So it's real challenging because we're not having access to people as much. Even if we look at Child Protective Services, social workers are not seen as essential workers. So they're not doing the same job that they once were. They're not needing to make the home visits, which is so important. So there's a lot of things that need to happen to protect children. So we have a real challenge. So there's no real good answer for that one.
Mm-hmm. Yes. Dr. Jones, how do we protect children who may be quarantined with an abusive parent?
I've been telling, check on your people, check on your family, check on your neighbors. I mean, if you live in a neighborhood where it's, you know, you feel enough, you can go check on your neighbors, knock on their door. If you know somebody is handicapped that lives across the street, like schedule a time a couple of times a week just to go over there, say hi, is there anything you need? You know, that is the best thing, one of the best things you can do right now. If you have family members that, you know, maybe have history of abuse or history of drug use or history of any kind of violence, yes, call them. And not only call them, you know, you have to ask maybe a couple of questions, drop by their house. That is what we have to do. We have to reach out, go into the community, knock on each other's doors to actually check on each other now. Because otherwise you'll have, like where I live, there's a lot of elderly people on my street. Some of them don't have visitors that come to their house. So if I just knock on their door and just say, how are you doing today? Or can I take your trash can out? That means the world to them. And then trust me, especially when it comes to the elder, they will ask you if they need help with anything else. So right now, just reach out, look in your phone book, call people, text people.
Right, I agree, Dr. Jones. We have to be intentional about this. And I also agree with the concept of starting within your own family, because if a child is suffering during quarantine with a parent, 9 times out of 10, that child was probably already suffering. But it is our duty as a community to the best of our ability, intervene. And that starts with intentional checking up on everybody that we know and going from there. Reverend Vargas, your thoughts?
My thoughts are, this is something that we have done at the very beginning of when all this pandemic started back in early April, is we made a list of our entire church community and we assigned blocks of these people to different leaders. And what they were doing was they reached out to the parents and they offered prayer and support. But then all the houses that had children in them, we also had youth leaders or kids worker, since we were in meeting, call them and talk to them. One of the things that we discovered is when you go, whether it's a phone call, you visit a home, in this case, let's say we go into our community, one of the questions we ask is, we ask for prayer needs. And what this does is it gives you your faith orientation. But secondly, usually when they tell you what they need prayer for, let's say something like peace, we need more peace in our household, there's too much anxiety, or that kind of thing, those are red flags in which you can circle back around. And so when we have those, we tag them and we put a little bit more kid gloves on it. We pastor that home. And I think just by asking the needs and how we can pray and come alongside will get you to kind of open up. There are some children that are going through some mental anguish. And then the last we did was we normalized that. Listen, I'm struggling with a few anxiety thoughts. So as long as we bring it out in the open and again, finding that common ground that I talked about earlier, and that's exactly what has given us success. We were able to identify homes that needed more prayer, some support. And usually that stress that's happening at home has to do with monetary problems.
Wow, yes, very good. And thank you so much for the great work that you and your church are doing, Reverend Vargas. Question number 3. And I want to kind of give some quantifiable advice to our listeners and our attendees as it relates to social isolation. And we'll start again with Dr. Flanagan. 3 things or 3 pieces of advice based upon your experience and expertise that people can follow to better manage this social isolation, because it's not something that just slaps you across the head. It's something that probably kind of creeps up on you, and before you know it, it's causing a mental health imbalance if you're not careful. So from all 3 of our panelists, and we would ask the attendees to please take notes, 3 pieces of advice to help us to manage social isolation, something that we are facing and having to deal with due to the global pandemic of COVID-19. Dr. Flanagan.
Things I would say to manage social isolation would be, 1, to establish a routine. That is really, really critical, to establish a routine. The second thing I would encourage one to do is to stay socially connected. Keep in mind, telephones are still good things to use, okay? And we have to be mindful that the elderly oftentimes are forgotten when we're all being socially isolated. So pick up the phone and call them, because they might not have access to a computer. Of course, you can connect with your friends with virtual meetings or happy hours or whatever you truly desire. But also, I would say to you also to continue to exercise and to spend some time meditating or reading something spiritual.
Thank you. Dr. Jones?
My first thing would be mindfulness, being mindful of how you are feeling, which means like you're giving yourself permission to feel certain things. Right now, like they said earlier, anxiety has increased tremendously during this time, but a lot of people don't want to admit that they're dealing with anxiety or depression. So being mindful, even saying it out loud, like I'm giving myself permission to feel anxious right now or sad right now. So you can work through those emotions rather than just sitting in them, allowing them to fester. Another one is I will tell people to go outside, take a walk. I know it's hot in Houston, so maybe go around like 8 o'clock, 7:30 at night, or early in the morning, but just go and take a walk, walk around your neighborhood, or go to a park, get some fresh air. You'll be amazed how just getting a little bit of sun, getting your sweat going on, it can just make you feel better. And the last thing, and Dr. Flanagan also said this as well, is reach out to people. This is a great time to probably talk to people you haven't talked to in a long time. Texting people, it's okay just for you to say, hey, I'm just checking in to see how you're doing. And using social media right now, it's okay to probably use social media just a little bit more right now, especially if you're more isolated, at home, and just reach out to people, talk to people, create something new.
Thank you, Dr. Jones. That's some sage advice there. Reverend Vargas.
Yeah, I would say that the three things I would recommend, which is what I've been recommending to my leaders and what I have done, is the first one is, you want to read something. Dr. Flanagan talks about read something that is gonna build you up, something that is going to inspire you, something that is going to teach you something new that you didn't know. Don't just, I would say, read. My wife likes to read murder mysteries. And she does it on her own time, but she's always reading something that is building her up, that is inspiring her. So you got to be reading something that takes you up. It's got to take you up. The second thing that I think that is really important, and it's the lost art of journaling. And I believe that in journaling, when you write things down, today I learned, even if it's 2 sentences, what you find is that there is a lot more good inside of us than we really think. And it's only once we start to, there's something about writing about your day, about yourself, that prevents you from beating yourself down. And you may start that way, but you never stay that way. And then the third thing is, I think everybody shared it, but take advantage of technology and FaceTime your closest relationships, your parents, your brothers, your sisters, your best friend, and make it a habit that every so often during the week, you get on a call and you don't talk about what's really happening in the world, but you share life, you laugh, and help each other out, like just by inspiring each other. So read, write, and share your life was what I had.
Beautiful advice, Reverend Vargas, and I agree. We have to remember that COVID-19 is affecting and impacting our world, but it is not the end of the world. So in the last couple of minutes that we have, let's just say I have a family member who I believe is experiencing a mental health breakdown at this time. And even though we're restricted from doing so much, what online resources are there available for a family member? And we'll go to Dr. Flanagan, and then we'll go back to Dr. Cosby.
Well, I guess I don't know exactly which online one, but a lot of therapists and physicians are actually seeing patients virtually. So they could Google a therapist, psychotherapist, because there's just so many that are out there. But also you have the Mental Health of America that's present in Nomney, that's here in the Houston area as well. They can go to those websites and find a therapist.
All right, thanks, Dr. Flanagan. I wish I could go to my other two panelists. Thank you all for the great information that you've given. And we want to send it back to our brother, Dr. Cosby. Thank you so much.
Thank you so much. What a blessing you all have been to us tonight. What a privilege it has been to hear from you. Thank you, Brother Muhammad, for leading us so wonderfully in that first panel. And we certainly want to thank Dr. Flanagan and Dr. Jones for helping us from a mental health perspective to understand how we might get through this social isolation we're dealing with. And thank you so much, Reverend Vargas, for bringing to us the spiritual perspective, that faith perspective that many of us try to hold on to during these trying and challenging times. We are made better because of your expertise. So thank each of the four of you for sharing with us tonight. We're going to move on now to our second panel, and this second panel is going to likewise help us with a rough reality with which all of us have had to deal on some level. Our mayor told us that nearly 60,000 people have tested positive for the coronavirus in Houston. And then he shared with us the reality that nearly 700 have died in Houston, Texas over the course of this pandemic season, 696 people to be exact as of today. That causes grief. The experience of grief is significant. And all of us on some level have to experience grief, whether it's death or some other process of grieving we have to go through. And so we have panelists tonight, and both a leader of our panel, a moderator from the faith community, and then panelists who will help us to understand how to process death in the midst of this pandemic. Please allow me to present to you first our moderator, the Reverend Pastor Byron Stevenson. We're so delighted that Pastor Stevenson is here with us tonight. He is the senior pastor of the Fort Bend Church. And we're grateful that along with him comes three speakers who are going to help us to navigate through the grieving process, the grief process. Cynthia Colbert is first going to share with us. She's the president and CEO of Catholic Charities. And we're likewise grateful that Reverend Brian Gowan, the senior chaplain of spiritual care and education at Methodist Hospital, is going to share with us. And then Christina Cipriano is going to likewise share with us. She is the director of Spanish programs and outreach at Bose Place. Each of these has blessed our community throughout the months and years, and they're going to share with us now as we now relinquish this time to our moderator, Pastor Byron Stevenson.
Thank you, Dr. Cosby, and for that introduction. I am excited to be working with a well-experienced panel of experts, which will help me to discuss this poignant conversation of processing death in the pandemic. And so I'm Byron Stevenson, senior pastor of the Fort Bend Church in Sugar Land, Texas. And I'm going to ask my fellow panelists to take a moment and just introduce themselves, starting with Reverend Brian Gowan, and then followed by Cynthia Colbert and Christina Cipriano, in that order.
Sure, yeah, hello, good evening, everyone. Yeah, my name is Brian Gowan. I'm a senior staff chaplain at Houston Methodist Hospital. I've been involved in pastoral ministry pretty much since after my college days, and been at Methodist Hospital for approximately 16 years.
Hi, everyone. My name is Cynthia Colbert. I'm the president and CEO of Catholic Charities. We provide a range of services to the greater Houston region, and counseling is one of those programs. I feel like I can definitely empathize with people who are experiencing grief at this time, as I lost my oldest son 2 years ago, and I know I can understand what people are going through. So I'm so glad to be here from our panelists and support one another in this greater Houston region.
Hi, everyone. My name is Christina Cipriano. I am the Spanish Programs and Outreach Director at Bose Place. I'm also a clinical social worker. For those of you who aren't familiar with Bose Place, we're a grief and bereavement center here in Houston that offers free grief support groups for children, families, and adults who've experienced the death of someone significant in their lives. There is no timeline as to how long someone can stay within our programs. We're really here to help the bereaved for however long they may need us.
Thank you. Well, gang, let's dive in. Processing grief in a pandemic. We, all of us, based upon our experience in dealing with grief, with those individuals we work with or we pastor, we lead, we find that it is a challenge in and of itself dealing with the grieving process. That process is further escalated by the pandemic that we're in. I was reading in the Q&A where someone mentioned that they would like to see a cultural aspect of our discussion in terms of dealing with the process in the communities of faith. As a pastor, having been a pastor for 16 years, of course, I've dealt many times with the families who are going through a grieving process. What I found in the past 5 months of the grieving process is families are dealing with not only the death of the person, but the actual process of dying in the context of the pandemic. What I'm saying is it used to be, especially in my tradition, where families would sit by the bedside of someone who's in their declining moments. They would hold their hand and brush their hair, just as a way of lending comfort to the person who's in the process of dying, but also comfort dealing with the grief of it themselves. Now, with the pandemic in place and the rules of social distancing and isolation, that sitting by the bedside, holding the hand, has been replaced with saying goodbye on iPads and cell phones. And having to deal with that takes a tremendous level of faith and prayer and inner strength, because that is something that's totally different than any of us have ever dealt with. They didn't train me in seminary how to pastor through a pandemic. And so we're learning this seemingly as we go along. So I want to start the conversation, and I'll start with you, Brian. Share with us how the pandemic has affected how people have been responding to the normal grieving process.
Yeah, so Byron, I would say one of the words I'm hearing a lot in communications about the society that we're living in with the pandemic is the word pivot, which really means to plant your foot and just take another direction. This has been traumatic, absolutely traumatic, because there's everything about the pandemic is counterintuitive in terms of the way humans interact, or we're just geared to interact with each other. In the early days of just studying grief and death and dying, one of the crowning thoughts and principles of death and dying that has remained constant throughout my years of ministry is one of the greatest fears that people have about death and dying is the fear of dying alone. You mentioned about the iPads. There's probably not a day that goes by that I'm not helping to facilitate, whether conversations or there maybe not even conversations, families just having a chance to just view their loved one while they're on a respirator and just speaking words of love and affirmation. It's just absolutely heart-wrenching. So I agree. I wasn't prepared for this. I'm a high five guy. I'll give you a hug and shake your hand, but we've not been able to do that. But I would say this: when we talk about heroes in the healthcare work, the teamwork that's involved in helping to facilitate relationships and the human touch has been a vital part of this.
Cynthia, would you mind chiming in on that?
Oh, sure. Well, I would definitely agree. We're meant to be in community as human beings. And so I think through this, we've had to create community in new ways, some of which we mentioned in the last panel, but through social media, reaching out. I will say that for those that are grieving, and it isn't necessarily a loss from COVID. It could be a loved one was in a car accident, already had an illness. The many reasons, unfortunately, that we end our time here and go home, so to speak. But there are many reasons why someone might pass. So I would say that we may not be able to be as present to the loved one, but those remaining still need our support after their loved one has passed away. And so finding community for them through text message, through phone calls, if you can, through a social distance meeting with them, but they still need you, and they need to hear from you. They need to share memories with you about their loved one. And so the need for support, and if you're a family member that is going through this, sometimes people need to know you need them. But for those of us that can walk along this journey of grief with those who have lost someone during COVID, I think they need our support now more than ever because of the differences that COVID has made.
Christina, many people struggle with what to say to someone who's going through the grieving process, particularly in the world in which we live now. How do you coach them through that? What do you say to them? What tips can you give?
So this is something we hear often, of just the desire to want to be helpful and to be present, but not knowing what to say, right? Words fail us. And oftentimes it's coaching people to just simply say the person's name, right? The person's name brings so much just power to the conversation. Oftentimes we feel as a society and as people that we're going to make the bereaved even more sad by bringing them up, by bringing up the memory. And I can guarantee you that they're going to be sad regardless if we mention that, but honestly, it's almost like a 180 where we bring comfort in remembering their person who died by being able to speak their name, by being able to ask, if we didn't know them, tell me, what was one of your favorite memories? What did you do during this time? What were these days like for you? Share, if I had the memory, sharing my favorite memories as well. Because oftentimes, right, a person doesn't just live with one person and have their entire memories with that one person. You are able to share just the small tidbits of stories that come up that you may have from your own memory. Also offering concrete help. Oftentimes what we, as people who are trying to support someone that we know who has experienced a death, will say, let me know if you need anything. And that's not helpful because you're asking someone to identify what needs they may have and then reach out and seek help. So what I would recommend is saying, hey, I hired a landscaper for you. They're gonna be here on Saturday. Hey, I'm sending you a meal for the next couple of days. Or in the time without COVID and we were in school, I'm gonna go pick up the kids. I'm gonna hire you a housekeeper, your laundry's taken care of. Like those concrete things of being able to offer support in such a way that takes the burden off the bereaved to identify what the needs are and seek out support themselves. So I'd say those are some of the tools that I would coach someone through in trying to support the bereaved.
In the first few minutes, I feel the brevity of this discussion and the pain as well, because not long ago, I experienced this personally with a close friend and also a member of our church who passed away without his family being around. And as you said, Cynthia, he did not pass away as a result of COVID-19. It was previous illnesses, but it happened during the course of us dealing with the pandemic. And that was a tough, very, very tough situation, even for me as a pastor, not being able to look them in the eye, not being able to say goodbye. And again, all of my training has not given me the right words, even the right tools to deal with the family who now has to deal with the sense of guilt. I wanted to shift and just talk about just how do we respond, even as a faith community, how do we respond to individuals after the death has taken place, the funeral has taken place? How do we help them to heal in our communities of faith? Cynthia, would you mind just chiming in on that?
Can you hear me now? Yeah, okay. Sorry. Our faith traditions are very important. Some people experience a crisis of faith after a loss of a loved one. And so just hearing from members of your congregation and whatever faith tradition that you may be in, I think it presents normalcy for us if we can continue in those traditions, even while maybe we're even questioning them or feeling like you feel disconnected sometimes from yourself and the community when you're going through grief. So for the faith community to kind of come around that person with practical help that Christina talked about earlier, messages of support. Friend of mine, you mentioned, I think journaling during this time is a very good way to capture memories and thoughts and feelings. But a friend brought me journals, so I didn't have to think about buying them, which was very helpful. If you have had something that you've read, sharing that for a later time, whenever they're ready to pick it up. So finding ways to support them and letting them know that they're not alone. And it could be a simple message, a text, a phone call saying, I'm here for you. I'm thinking of you, or I'm thinking of your son, your daughter, your husband. This makes me smile. Just messages that let them know you're still part of their community, even though you, the grieving person, may not be as present because of the grief experience.
Okay, great. Brian, as a chaplain, you seem to be, in a sense, part of that crew that's in the trenches many times. How how has the world changed in terms of helping families to cope? How has the pandemic changed that for you?
Sure, that's a really, really good question. The reaction response is normal. Families are angry because they can't be next to their loved one, and I totally understand that. It's all counterintuitive. It's not how we're geared. Family systems have had the opportunity to, on the positive side, to do some reconciling. Does that make sense? And kind of, hey, we've got to get together here and let's go ahead and, bury whatever negative feelings. We've really got to come together to get behind mom or dad or a relative. So that's been very, very evident. And I think that these times can bring maybe some of the most difficult parts of our life up to cause those things to surface. Can bring the best, but I just think we need to be patient with one another. We've never been this way before. So the family systems have really taken a really big toll, but I do think that as we walk through this time, I would say the principle, Byron, of being not just quick to listen, but to be really, really, really quick to listen and really, really slow to speak. I think we kind of need to slow it down in order to be effective as family members and as caregivers.
I found that every tool that I've used to counsel through the grieving process of those tools of compassion and love and understanding, it seems as though I'm having to push those even further and even go overboard just to compensate for, as you said, those families that are dealing with not being able to be there. And the grieving process can be, it's not a one-time and you're done exercise. I mean, there's time that has to take place in order to heal one's self emotionally and spiritually.
But I would say also, Byron, there's the phrase, time heals all wounds. Maybe if we make good decisions in the midst over time, does that make sense? Making healthy decisions over time will really help us to heal those wounds and help work through the process.
And perhaps the broader community, Christina, may not feel the impact of really what's going on unless you've been impacted closely by someone in the who's died because of the pandemic or during the pandemic rather. Are you seeing a for lack of a better term, uptick in people needing grief counseling during this season?
So what I'll say is that the unique thing about death itself is that it's going to happen to all of us at some point, and and at some point in our lives we will know someone who has died. So our cause kind of took a dip right around March when the stay-at-home order went into place, but shortly after that we're back. I'll say to what we were operating at this time last year in terms of those who are reaching out. So I'll say what we've seen more of is folks reaching out for virtual support and asking, is there virtual support available? Which there is. That is probably the number one thing that we're seeing right now, and rightfully so. So to the point that was mentioned earlier of reaching out, it's imperative to be able to use the technologies that we have if we know someone, right? Even I think we're getting to the point where we know someone who might know someone, being able to just reach out and saying, I'm thinking about you, a quick text, using the technology that we have to be able to connect with one another. It's one of those things where, unfortunately, death being a part of life, we're going to know someone. It's just, I believe now there are more people who know someone or know of someone who has died in the last couple of months.
Right. we have a few minutes left. I wish that we had more time to dive into this subject, but I want to give each of our panelists just a moment to share anything that's on your heart, any closing comments, share any resources that you would like to share. Cynthia, we can begin with you. There we go.
If you have lost someone and you're going through the grieving process now, I would encourage you to reach out for help, support. And it's hard to ask for help. I understand that, but ask. You know, ask to be connected to people, ask to share your stories about your loved one, because it's important to talk it through. And if you need counseling or would like that, there is Bo's Place. There's other resources. Catholic Charities has a counseling program. So I would say, I would encourage you, find the resources. Could be an online support group, many ways to get support, but don't walk through this valley alone, because it's important that we find people to walk along with us.
Brian, any closing thoughts?
Just a quick thought. I'd like to encourage our viewers and listeners to reread the first couple of chapters of the book of Job. Job's friends, quote unquote, saw him from a distance, and they sat with him for 7 days and they wept. And the Bible says, and nobody said a word. The gift of presence. What people in grief need is the reassuring presence of someone who is not secretly and silently running away. The ministry of presence is so important. Don't feel like you've got to talk or fix anybody.
Christina?
I'll say grief has no timeline, right? We mentioned this. It's a lifelong journey. And so even if you know someone or have experienced a death yourself in the last couple of months, knowing that this is a lifelong journey, right? There is no handbook, there is no, you do this and then this will happen and this will happen. It takes twists and turns. And so to those supporting the bereaved and those supporting others, knowing that it's not just the first couple of months that person needs you to reach out, it's years, it's just every now and again when they come to your mind, sending them a message and letting them know, hey, I'm thinking about you. Putting those ticklers, I mean, the beauty of technology right now is that we have calendars that will remind us, right? Putting in anniversaries into our calendar so that we know on that day to reach out to that person and let them know, hey, I'm thinking about you today. It's important. And the one thing that I've heard throughout my career is that support is often given within the first couple of months after the person dies. And then friends trickle off, support trickles off, and knowing that it's lifelong. So to continue that support, continue those touch bases throughout just life in that regard.
Yeah. Thank you, everyone. This is a tough conversation, and I hope that we have inspired further dialogue about this very important, critical subject, particularly when we are at 696 deaths. Wow, in the past 5 months. Our communities of faith, they really need us, and it takes us to be strong in our faith and in our walk, to be able to be a strong encouragement to them. And so I want to encourage each of you, each of the panelists, to continue to allow your insides to come out as you encourage others, as you lead others to encourage those who are dealing with death during the pandemic. And we all pray that this will be coming to an end real soon, is our prayer. Thank you again for your time and sharing your thoughts. And I'll hand it over to our Master Ceremonies, Dr. Cosby.
Thank you so much, Pastor Byron Stevenson, and thank you, panelists, for sharing so powerfully with us. Thank you for freeing us to grieve. we have to be sometimes freed to do that, because oftentimes we think we have to be so strong throughout the entirety of the processes of our lives. But I'm so grateful that you, through your expertise, through your acumen, and through your powerful presentations today, have freed us to grieve. Thank you for reminding us that we don't always have to have the right words to say, but our presence speaks volumes. And so I'm certainly grateful to each of you for your personal stories and for your professional advice. And may God bless you and your work as you continue to go forward. Thank you again, Pastor Stevenson, for your leadership tonight. We've come now to our third and final panel presentation, and we're excited that we have the opportunity to look now at yet more interventions for our mental health. In the first panel, we heard much about how we can help, especially young people. But in this third panel, we'll dive a little more deeply into some of those interventions we can participate in or be invited into, so that we might help those, both youth and adult, to navigate through these COVID waters that we're trying to get through right now. And so I'm excited to bring to this discussion, first of all, our moderator. Our moderator is certainly a gifted woman who continues to do great things as the Director of Department of Neighborhoods. Takasha L. Francis is going to lead us in this next discussion, and we're so grateful for her and for all that she continues to do to make our neighborhoods better. And we're likewise honored to have from the faith community, Dr. Max Miller. He is the senior pastor of Mount Hebron Baptist Church, Missionary Baptist Church here in our city, and he's going to bless us. He's also a leader of ministers here in our town, and we're delighted that he is here with us. We'll hear from him shortly. Dr. H.E.R. is the Baylor College of works at the Baylor College of Medicine in Bentab Hospital, and he will come with that medical professionalism that he has to share with us in this conversation as well. And then finally, Dr. Laurel Williams from Baylor College of Medicine is going to help us to likewise have some insights into what interventions we can participate in with regard to our mental health. Thank you, ladies and gentlemen, for being with us. Dr. and Sister Takasha, I hand it over to you now to moderate this third panel.
Thank you so much, Dr. Cosby. And I want to thank everybody for joining us tonight, as well as our panel of esteemed experts and faith leaders. The other night, we were looking at the Democratic National Convention, and Vice Presidential nominee Kamala Harris mentioned in her acceptance speech that America as a country right now is grieving. And so we listened to our last panel where we talked about grief and how grief, of course, takes the form of losing loved ones, but we also can look at grief in terms of how we lose different things, whether it's relationships, the normalcy in our lives, the life we knew before the pandemic hit. We're all grieving that collectively as well, which feeds into the anxiety that we have. And it brings us to the point of this panel tonight, how we can intervene with appropriate mental interventions, not just for us as adults, but also for our children. Now, as Dr. Cosby mentioned, the very first panel covered a lot of things we wanted to cover in this panel regarding our children, but I do want to go back to a few questions so that we can start looking at how we might be able to be more effective with how we are handling this pandemic and how it affects our kids as well. But of course, before we start this panel, which talks about exploring mental health interventions for youth and adults, I would like for the panel to introduce themselves briefly so that we can kick off our panel discussion. And we'll start with Dr. Max Miller.
Let me thank each and every one of you who made this possible. Sure, Sister Francis, for what you have done and how you've demonstrated the leadership. We thank God for another opportunity. Dr. Max Miller, Senior Pastor of the Mount Hebron Church, and also the President of the BMA, which is the Baptist Ministers Association of Houston and vicinity, and a servant leader of the Great God.
Thank you so much. Dr. H.E.R.
Yes, my name is Dr. H.E.R. I am a psychiatrist, and I'm a professor at Baylor College of Medicine in the Department of Psychiatry, Family and Community Medicine. I'm also Chief of Psychiatry at Bentab and current Chair of Mental Health America, Houston. Thank you.
Thank you for being with us tonight. And we want to round it up with Dr. Laurel Williams. Welcome.
Hello, good afternoon, good evening to everybody. I'm so excited to hear. I've already learned so much just listening in. I'm a child psychiatrist here at Baylor College of Medicine. I really like to say I'm a family psychiatrist because so much of what we need to do is support the family when we support the young person. So I'm excited to help out tonight.
Thank you so much. And actually, Dr. Williams, I want to start with you tonight. So as you mentioned before, your background is in family psychiatry, and we are all collectively dealing with coronavirus and how it has brought about a significant transition moment for us in our country's history. It's brought about a significant transition moment for all of us in our mental health by either creating issues that weren't there or exacerbating issues that actually were there. So as we are dealing with kids and the schools that had closed, but also now some schools are opening, kids are returning, parents are obviously, feeling a certain level of anxiousness about their kids going into those environments. And some of these kids are feeling it, whether it's the social isolation or now having to go back to school in a different way. And not just our kids that are in elementary, middle, and high school, but there's also a level of anxiety with our kids that are going back to college. Last week, we just saw a number of universities who have had to shut down because they've reopened. COVID is, of course, spreading communally because of the setup. And so now you have our kids in college who are having to deal with a lot of those changes. How can adults and parents help their kids navigate these issues? And I know it's a loaded question and it's a lot, but how can we do that?
I really want to just, actually the first panel and the second, really talk deeply about what I care about. It's actually connecting with the kids, actually modeling with the adults. So telling kids in a developmentally appropriate way what you're anxious about, what you may be frustrated about, and showing them how you're dealing with it is very helpful and soothing for a young person. If they can't see how to move forward in a problem, that's cause them to feel even more uncertain and more insecure. And that to me then means the family needs help. And that's where I go back to the faith community, your other peers and support, is that as a parent, if you're really anxious about what to do next, reach out and get some support yourself so that when you support your child, you're doing the best for them too. It's really all hands on deck here. And one of the nice things a little bit about the pandemic has been the expansion and explosion of doing telehealth. So there's a lot of opportunities, both with just doing it through your faith community, through your friends, but when you actually get to that point where you need help, there's now a lot of opportunities, either telephonic, if you don't have a computer, or even using a video conference if you need that. But I really can't stress enough, if a parent is struggling, they need support before they can support their kid.
And speaking on that, Dr. Williams, if I am a parent, we know that our kids don't necessarily, and it depends on the relationship, but they're not always forthcoming about those issues. So how do you broach that topic with your children?
Yep. And so I'm a single parent of a very rambunctious, lovely 8-year-old. And I actually find that the moments that we get the most out of our conversations is when I'm not actually asking those questions. Mm-hmm. Usually maybe in the car, something kind of comes up and she brings something up that makes me kind of go, I think she's worried. And so I ask her, and we always talk about this idea, just ask. A lot of times with mental health, we're afraid to ask a question, A, because we're maybe sometimes afraid of the answer, but B, we're not sure what to say next. So I go back to the previous conversation of just having your presence. So I really find that if you actually kind of try to get a kid, corner them for lack of a better word, and say, how are you feeling? What's going on? They really will shut down. But if you're in other moments of just community with them, that's when things come up. And then you have that opportunity to inquire and ask and really get their input versus directly, again, the second panelist going into problem solving mode. A lot of times we don't need to solve a problem right away. We just need to listen and support them. And so I would say my favorite sort of idea around that is the movie Inside Out. And there's a really lovely moment where a character named Bing Bong is really struggling. And it's not joy that helps the character get better. It's actually sadness. So it's that idea of joining together with how a person is feeling really helps them to feel better versus invalidating them by just trying to get them to think about all the positive things. So it's definitely a balance.
And when you speak of balance, I mean, at this particular point, COVID and everything that's happened with COVID, this is just our life right now. And while it's, we don't know when it's going to end, that's a lot of the anxiety about it. It's not like anything else we've ever experienced in our lifetime. So when your child does open up and tells you that they're afraid and tells you they're scared, how should you respond to that? I'm pretty sure, there's this tendency to want to, of course, be positive, you know, and be the strong one in that moment. But how do you balance being truthful with a certain level of vulnerability?
So I do think that you want to be thinking about the idea of telling them what they can do, what action steps that they can do that will help them stay safe, help their family stay safe. So going back again to that first conversation about how to get the YOLO teens to, you know, care about others, is actually make it like, you know, yes, you can't go to a party, or yes, you can't do this, but here's what you can do. You can wash your hands. You can wear a mask. You can write a lovely letter to your grandma who you're missing and she's missing you too, and connect with each other. So you actually need to focus on what things you can do as much as spending on times with things you cannot do because they're not safe.
Wow, thank you so much for that input. And speaking of what we can do, I want to turn to Dr. Max Miller right now as we're talking about, you mentioned the faith-based community, Dr. Williams. And so when we look at the faith-based community, Dr. Miller, how can faith-based communities, churches, assist in helping to identify the adults that have existing issues? And how can we address those?
That's a twofold question there, because when we deal with the adults, first of all, we have to be real that all of us need some help. It does not matter how strong we are. Dr. Cosby mentioned that as he was talking, that we all need some type of help. We are strong. I think the mayor mentioned it as well, but you're identified by really knowing the person and then knowing the community in its totality. When you're able to learn the person as well as learn the community in totality, we understand that it's not a one size fit all. Once we understand and be real, as our young folk will say, if we will keep it 100, that we are not invincible as we portray. I say quite often, even on Sunday mornings, many of our members can win a Grammy or Emmy because we try to put on the facade that everything is okay, instead of realizing and admitting that we have been broken and we come to church to get some energy, to get our joy back. So when we look into the communities, two things we have to do other than connect. I love what Dr. Reverend Vargas mentioned and Dr. Flanagan and Dr. Jones about the connection, but also we have to make sure that we build a trust relationship, that people will want to come to the faith community to get answers and can trust the answers that we give because we have built such a trust relationship. Also, we have to be engaged, that we inform them and let them know that they're not in it by themselves. Even children as well as adults. It's something that we do in this class that we teach called biblical counseling, and it's called categories of change. Since we have heard about pivoting, even in grief, pivoting, even in youth and adults, if we pivot and really learn who the person is and see their needs as well as their wants, once we build that trust relationship and they open up, we'll have to see if the hearts, the motives, and desires, we would call that a C1 if we were dealing with the categories of change. Once we really understand the fulfillment of the motives and the hearts, then we'll look at the communication patterns as well as the behavior patterns and be more of a listener than we are a talker. Be more of a servant than trying to serve. And when we listen and we listen to what is actually being said, because of what we have gone to school for, whether it's in the seminary, as many of us have been, or if it's through life experience, we can really hear what a person is crying out for, and that we can let them understand and know that I've been there too. It appears that the more we are involved with the commonalities of what someone else is going through, is more of a trust factor than we can build on.
And Dr. Miller,
yes.
I hate to interrupt you, but I wanted to catch a very pivotal moment because you said this last time and you're saying it now. Will you please let people know it's okay to have Jesus and a therapist?
It's okay to have Jesus, to have the Trinity, and to have therapy. Because sometimes we need the therapy to keep the Trinity in mind and keep it in focus.
That's right. And whatever else comes with that therapy too.
Whatever comes with it,
there you
it's
go.
Okay. And when people understand it's okay, then they will open up to you. But as more as we make people think we're on the mountain and they're in the valley, there's a disconnect when we're really trying to connect.
Hey, awesome. Very good point. Thank you so much for bringing that out. And I realize that, you know, we're getting close on time. This is such a rich conversation, but I want to give Dr. Shaw a moment to comment. And if we have a moment, I want to come back to another point. But Dr. Shaw, I know that you work specifically in mental health and psychiatry. And so even as we are looking at people going back to work, whether they're essential workers, there is an anxiety still around how we return to work in other environments safely. So how should we balance our safety and our mental health, financial need? There's just a lot going on with everybody right now. How do we balance it and deal with everything?
Yeah, it's a very good question and important question. There are numerous ways we can balance. The first thing we are facing is we all talk about social distancing. I don't even think we need to say social distancing. We need to say physical distancing because we want to socialize with each other. Unless and until we socialize, we don't feel good. We don't feel better.
Right.
Earlier, we were talking about virtual connection. Virtual connection is very important because we know that if we don't socially interact, we develop touch starvation, which makes us more depressed, which makes our immune system bad, and which stresses us out. So what we can do to look after ourselves, our physical health, our mental health. Think about it. What we can do is simple things. Eat good. A lot of us are at home right now. We are eating more than needed. Some of us are gaining weight. You think it's going to help our mental health or physical health? No, it's going to make it worse. Other thing we can do is exercise. People are using an excuse that, oh, I cannot go for exercise. If you cannot go, exercise at home. Keep in good shape. People who use drugs or alcohol, they need to minimize that, maybe not even use it at all, because you're at home, you may be doing it more. Anybody who has any illness is the one who's going to be more stressed during this time. And we need to be very careful about that, that this is the time that people who have pre-existing mental diseases, pre-existing drug and alcohol would be more stressed. We need to be very careful about that and try to get them more help. Watch for the warning signs. So if we don't do that, they will be at risk. And lastly, we need to communicate. I think the biggest problem is communication, especially with kids. You were talking about kids earlier. Parents are the role model for kids. So if we are a role model and we are going to hide things, parents, you are the one who's going to make the problem because kids are going to get more anxious by us hiding things. So please don't hide from your kids. Explain them everything as logically as possible, communicate with people, and not only communicate with people, we need to think about being positive. What is the harm about staying positive? We all need to stay positive and optimistic because if we are positive, we are optimistic, we can beat this quickly. We can beat this and we can be in control. We don't want the pandemic to be in control. We want ourselves to be in control of this. Pandemic is not going anywhere. Maybe a year, maybe 2 years, maybe longer. No, we need to be in control. We need to beat that. That is the reason I always say no social distancing, only physical distancing.
Now, when you mentioned Dr. Shaw being in control, you are also the chair of MHAHouston.org. So would you tell us a little bit about the organization and some of the resources that are available to our viewers this evening for their mental health needs?
Thank you. So MHA.org, which is MHAHouston.org, is Mental Health America Houston, which has combined with Fort Bend Mental Health America also. So it's a combination of Greater Houston. If you go on our website, which is MHAHouston.org, you can find numerous tools. So the first thing you will see on the first page is a screening tool. It's a 5-minute screening tool, which will identify if you have any mental health need. You will see on the second page or on the second link, you will see all the mental health resources, which includes people who are talking about abuse hotlines are there, suicide hotline is there. There is an 800 number from state of Texas for COVID, that is there. All the resources are there. Now, the biggest challenge we have in this pandemic and even in other pandemics and disaster is we talk about resources, but we talk little about resources for people who are underserved or underprivileged. I would like to specifically mention that population because I work at Bentop and I'm the chief of the Division of Community Medicine. So that is my biggest target. My target is to provide care to people who don't have insurance, who don't have money. Right. On that site, MHAHouston.org, you can also find links to areas where you can get free health, free mental health, free physical health, whether it is Harris Health, whether it is Harris Center, whether it is Legacy, whether it is any other FQHC, whether it is Ibn Sina, you can find all those links and phone numbers. In this town, we are lucky that we have a wonderful mayor. We are lucky that we have numerous resources available for people who don't have money. So there is no excuse not to get help. You can get help even if you don't have money. There's no problem in this town. And you can get quick help, which is the most important, because to me, access to healthcare is important, but timely access to healthcare is even more important.
Thank you so much, Dr. Shaw, Dr. Miller, and Dr. Williams. We have to wrap it up, and I want to thank you for participating in such a needed conversation. I want to reiterate, of course, as we leave this panel and turn it back over to Dr. Cosby, that the web address is www.mhahouston.org. So if you don't have insurance, if you are low income and you still need help with mental health resources, please take advantage of going on the website, or if you know someone that you love that needs the resources, please take advantage of it. Also, look to your houses of faith. Many of our churches are extending beyond the corporate worship experience and having outreach activities that could help you. So as we become available, or as they become available, we'll be happy to share, but check with your own house of worship to see what is available. So thank you so much for tuning in tonight, and we want to turn it back over to Dr. Cosby. Thank you.
Thank you so much, Takashi. I appreciate that. And to all of you who helped us tonight to have a better perspective on some interventions with regard to our mental health. Thank you so much. Dr. Shaw, Dr. Miller, and Dr. Williams, you were invaluable resources tonight. I thank you for not simply giving to us the theoretical perspectives out of which you certainly have studied, but you gave to us practical elements with which we can make some steps toward even greater mental health. So thank you for the practicality of your remarks tonight. Each of us can use what has been shared with us from each of these three panels, and I hope that you will. I hope that you will not allow this pandemic to put you in a place where you do not get the help, the assistance, the progress that you need. All of us will need something during this season from beyond ourselves. And so I hope that you will not only use the faith that you have, but likewise balance that with the practical mental health resources and tips that we have learned from our presenters this night. I know what it means to deal with grief. I know what it means to deal with loss. I know what it means to deal with devastation. And I also know that despite my strong faith, I can't deal with it by myself. And I know what it means to have those moments where you really can't feel like going on. So in those moments, I invite you to get some assistance, use the help. Dr. Shaw says it's free, it's quick, you can get access to it. And I hope that you will do that as these days continue to pass. Friends, I hope that you have been made better as a consequence of sharing with us tonight. We have had wonderful presenters to give to us invaluable information. And I'm grateful to the city of Houston and to our mayor and to the H.E.R task force and all those who worked with them for ensuring that we would have this time, this second town hall on this issue of mental health. And we are certainly grateful that we've been able to take advantage of these experiences and these experts who have shared with us today. I'm going to turn it back over to Sister Janice Weaver now. She's going to continue to give us next steps as to how we can make even more progress. She is, of course, the Director of Youth Community Relations for the Mayor's Office, and we are so grateful that we can see her already masked up. She's telling us by example what we should do to ensure our continued progress. Remember now, Dr. Shaw has advised us, it's not necessarily social distancing, it's physical distancing. We have to stay separated from one another to maintain our health. So I hope that you will do that. Wash your hands, use some sanitizer, and let's do our best to eradicate this virus to the best that we can here in Houston, Texas. Thank you for the opportunity to share with you tonight. It's been a delight to be with you. And Ms. Weaver, it's in your hands.
Oh, awesome, awesome, awesome. Yes, mask up, everyone. You should have your mask on tonight, as a matter of fact. Let's go ahead and go to the next slide. Dr. Cosby, how can we say thank you for hosting us on this evening? We truly, truly, truly do appreciate you taking the time out of your busy schedule to be with us on this evening. Let me quickly go through the next step. So our mayor encourages everyone to get tested. There are 5 mega testing sites along with 15 other sites that are available. They are all free. We ask that you go to houstonhealth.org or call 832-393-4220. Next slide, please. We know that the census is here. We want you to encourage your family members. We want you to encourage your friends, faith leaders. We want you to encourage your members to sign up for the census. We did have a date of October that has been changed. You can go to the next slide. So the census timeline has been cut. The deadline is now September 20th. I think that's wrong. I think it's actually September 30th. Mayor, you can correct me on that. Next slide, please. Voters registration. It is so important. If you have watched just this week, the national convention, and I was so inspired every single night. We want you to know that you can register to vote, have your members vote, have your family members vote. Voters registration ends before October the 5th. You can register online as well, or you can go by a voters registered office. Early voting does begin on October the 13th, and election day is November the 3rd. Next slide, please. Be Well, Be Connected, providing coordinated mental health services to youth in the Houston area. You can log on to Be Well, Be Connected at bcm.edu or call 713-798-2567. Don't try to write this down. We're going to provide you with every slide that we have presented tonight. Next slide, please. Child Psychiatry Access Network. You can call 1-888-901-C-SPAN. That's pretty easy to remember to complete enrollment and use the QR code. We will provide that to you as well. They are here to collaborate on the best care for all patients. Next slide, please. And Dr. Shaw has already talked about Mental Health America. He gave you a plethora of information there. So next slide, please. Texas Health and Human Services COVID-19 Mental Health Support Line. So again, don't be afraid to call someone for help. This help is available to any and everyone. You can call this number by dialing 833-986-1919, and this is the Texas Health and Human Services Department. Next slide, please. Houston Crisis Hotline. As you can see, we have a list of numbers from, well, first of all, if there's any danger, please call 911. You have the National Suicide Hotline, the Crisis Intervention of Houston, Memorial Harmon Mental Health Crisis Center, Harris County Psychiatric Center, the University of Texas Harris County Psychiatric Center, Veterans Administration Mental Health Number, Sexual Assault, domestic violence. We know that that is a big one right now. LGBTQ Houston and the Harris Center for Mental Health Helpline. Next slide, please. Okay, this is the big one. This was just launched. This is the rental assistance program. If you know of anyone, this is by Baker Ripley that needs rental assistance, they can go to houstonrentalassistance.org. The landlord enrollment began on August the 17th through the 26th, and tenant applications will be August 24th through the 30th. Next slide, please. So, you know, we're talking about masking up, right? We want everyone to, and Dr. Cosby, we can't repeat this enough. Please mask up. If you're with your family members and friends, mask up. If you're going into a grocery store, mask up, guys. I want to again thank our host, Dr. Marcus Cosby, all of the moderators and the panelists. But most of all, I want to thank Bloomberg and Associates. Clyde and Luna, you guys were fantastic in helping us put together the second panel town hall. This was the mayor's request, and we certainly hope that we did a good job. And then to my H.E.R task force and colleagues, thank you guys for your support. I feel like I'm in the Academy Awards right now, guys. To the Faith Leaders Subcommittee, I'm not going to call any names, but each 15 member of the subcommittee, thank you guys so very much, because everybody that knows me know my tag, and you can't steal it because I've copyrighted it. It's all about the city. So we will now hear from our awesome mayor, Mayor Celeste Turner. Okay, Mayor, take it away.
All right. Can you hear me?
I can.
Okay. Look, let me just again, let me thank everyone, Dr. Cosby, my friend. Thank you so very much for giving up your time. For all of the moderators and the panelists, just a fantastic job, and to Janice and the H.E.R task force, Shannon Buggs, who's given leadership of it, and to all of those affiliated with the Health Equity Response Task Force, and to all of those who have taken the time to be a part of this meeting tonight. And literally, I think we had even 4 times the number who registered for this event as the first one. So it is clear that there's a tremendous need for information. And let me just say, we've all been very much helped. I've been helped by what has been said this evening, and I cannot thank you enough. And then lastly, what I will say, and on a humorous note, because these are some very challenging times, and we mask up, and I tell you, I've got masks everywhere. I think I may have about 500 masks, different type of masks all around me. People send me masks, a whole lot of them, and then and I'm out and about quite a bit at food mass distributions, testing sites. I've gotten to the point I even put on 2 masks at one time. But I will tell you, get home and you're sitting in the chair and reading my book or writing or watching television, and then I may cough a little bit, and your mind will play tricks on you, and or you start feeling like you're a little hot, and you take your temperature, and start saying, okay, do I have the corona? And it's amazing how your mind can really just take off. And so this physical separation is tough. The losing of loved ones, people going to hospitals, as was said, and you're not being able to be there with them. It's just tough. These are challenging times. So let me thank all of you for providing needed, helpful information for our kids, as well as those who are older, the adults as well. So again, my thanks to everyone. Keep lifting everybody up, and together we will get through all of this. So look, good night and be safe. Put your mask on, and this too shall pass. Thank you.
Thank you so much, Mayor.
Thank you.
Thank you, everyone. And Dr. Flanagan, can you quickly announce the announcement for tomorrow, please?
Yes, tomorrow we will be at in the Alief Westwood area for the Mayor Turner's H.E.R Task Force, Medical Care and Faith Leaders distribution event. We will serve over 1,000 families, and we will distribute masks, food, milk, and educational material. So if you know anyone in the area, or if you want to come out and volunteer, you can do that during the pandemic time. Please come out and join us. We have currently over 100 volunteers. So we will also have people there to register you to vote and to also do the census. So hope to see you guys there.
Yeah.
Good night, everyone.
If you stick around, can you hear me, Janice?
Yes, sir, I can.
Yeah, if you all will stick around, I'm going to put a track on, and
No,
we did.
no,
Brian
no,
Courtney,
no.
Brian
Yeah,
Courtney,
everybody, y'all can.
I have a closing song I want to sing. I want to.
Okay, everyone can leave, and then he can
sing, Mr. Mayor. Sing, Mr. Mayor. We want to hear you sing.
You better get some help. Where are you, Brian? Brian, we need you quick.
No, good night.
Train to Georgia.
Everybody.
Thank you, everyone. Thank you, Mayor, for your humor as always.
Good night.
Good night, everybody. Thank you to our interpreters. I forgot to mention you guys. Thank you.